Welcome back. Well, headaches are something that can be life-altering and crippling for some people. Joining us now to talk about this important topic is Dr. Joseph Casaly, headache medicine specialist with Hartford HealthCare Headache Center.
Hi, Lisa.
How common are headaches?
I think most of us have had headaches occasionally. Headaches that they would take a couple of over-the-counter analgesics for would go away quickly and it really wouldn't impact their day. But, the people we get concerned about are the people who have recurrent headaches with associated symptoms like nausea, light sensitivity, sound sensitivity, and who have disability from headache, who can't go to work, can't go to school. And that's a fairly common problem. Actually, it's usually migraine. And in any given year, 18% of women and 7% of men have migraine. So it's very common.
Yeah, I have some headache sufferers in my family, and it is debilitating. All right, what are some of the causes of headaches, and when should you see a doctor about them?
Well, I think the most common cause we see and in the population is migraine. That's a very common issue. There are some other types of headaches, such as cluster headache, headaches caused by neck issues that can impact people. But again, if it's recurrent, it's usually migraine. And that's something you should see a doctor about. There really is no good reason to be laid up frequently because of a headache. It's really a very treatable problem.
All right, what kind of treatment options are available at the Headache Center?
Well, we look at both trying to prevent the headaches from occurring and to provide agents to stop the headache when the headache occurs. In terms of preventive therapy, there's non-medicinal techniques that we counsel patients on. Simply doing something like keeping a set sleeping and mealtime schedule every day. Decreasing caffeine intake can be very helpful. But for most people who have frequent headaches, we're going to offer medicinal preventive therapies, and there's some very good agents out there. And then we're going to offer, for acute therapy or therapy designed to stop the headache when the headache occurs, we'll offer medicines that can really quickly stop the headache and often are very well tolerated.
All right, you have an upcoming education session about headaches. Quickly tell us about that.
Yeah, that's going to be on next Tuesday at 5 p.m. It's going to be kind of unique, I think. We're going to look at when a patient comes to the Hartford Headache Center, what we're thinking about when they come through the door. The patient's complaints of headache, and as they get into their history, we want to show the patient our thought process and how we decide what type of headache they have, what are what we call red flags for headache that could imply a very dangerous cause of headache. And then we're going to get into things we talked about today, things like who has headaches and how we treat them and counsel them in that regard.
All right, Dr. Joseph Casaly, thank you so much for joining us.
All right, thank you.